Hello, and welcome to the Arkansas Center for Health Improvement's podcast, Wonks at Work. I'm Craig Wilson, your host, a self-declared wonk, dad of 2 boys, native Arkansan, and I've been the health policy director at the Arkansas Center for Health Improvement for more than a decade. On this show, we aim to demystify, boil down, and unwonk, if you will, complex topics so that you can understand how the healthcare system is working or not working for you. Today, we're going to talk about the interaction between individual and family social needs, such as food, housing, childcare, and transportation that we know when lacking are real-time gaps that impact physical and mental health, well-being, and safety. The critical impact of unmet social needs on health outcomes is not new to healthcare providers, but most providers have been ill-equipped to address these needs. Social services are generally not the types of services offered within the clinic walls and are often provided by a patchwork of community-based organizations with their own distinct network separate from that of healthcare providers. Some healthcare providers have avoided screening for social needs for several reasons. Well-vetted screening tools that could be administered so as not to disrupt the patient flow have been hard to find. Within the last few years, however, the American Academy of Family Physicians and other health professional organizations have developed and validated screening tools and guidance for providers to quickly and efficiently screen patients. But even with these tools, some providers have been reluctant to screen because they are challenged with the ability to actually link patients with community-based resources. Perhaps the biggest reason has been the absence of a financial incentive. Healthcare providers are paid for providing medical services, not really social services. The growing recognition of the need to integrate social care with healthcare, along with strong financial incentives on healthcare providers to focus on improving outcomes as opposed to outputs in the form of patient visits or services provided, has driven the desire and thus an emerging market for a way to identify patients' social needs and connect them with community-based services. And there are some innovators who are stepping up to the plate with solutions. So here to talk about a local effort in Northwest Arkansas is Josh Hall, who is the executive director of Hark, a division of the Accelerate Foundation, where Josh is also vice president. He is a graduate of the University of Oklahoma, where he earned his bachelor's degree in social work, and of the University of Arkansas, where he earned his master's degree in social work. So Josh, welcome to the show. Glad to have you here.
Hey, thanks so much. Excited to be here.
Yeah, I know there's a lot of energy in Northwest Arkansas, so I'm ready to capture some of this right here in the podcast. So before we get to some of the more serious stuff, which we're going to get to, I want to keep us on a little bit of a lighthearted note, and I want to know what keeps you busy when you're not working.
Well, I am, directly in that stage of life where, family, kids activities, all of that seems to be about all that I do outside of work, which is really fun. So between, kids sports and one of my sons loves sports. He's all in with that. I have another son who he's a drummer and so he's playing in shows and all this fun stuff that's going on right now. And so we just love to spend time together as a family with friends. We love to travel together, all the things.
All of the good life right now.
That's right.
I'm in that same part of my life, and it's wonderful. So I asked this of all of our wonky guests, and since your son is a drummer, I'm assuming that you're going to have a good one for this. What would you say is your theme song?
Well, I wish I had a good one. I probably don't have a theme song, but I will say that if I was to have one, it would probably be in the 90s rock genre. And my son and I, he's 11 and he is obsessed with 90s rock right now. And so I feel like I'm training him up well. I'm training him up well.
That's awesome. Okay. So
first, I want to know a little bit about the Accelerate Foundation itself and why the foundation decided to invest in Hark at this time.
Yeah. So I'll kind of back up a little bit with the start of the foundation. And so the foundation was formed out of the sale of two hospitals here in Northwest Arkansas. So they were nonprofit hospitals, were sold to a for-profit entity. And, the question there is, nonprofit hospitals, they kind of belong to the community. So, if you sell them, who gets the money? And so those were rolled over into a health conversion foundation that over the last kind of 20 or so years has evolved into the modern day Accelerate Foundation. And so that's really where the foundation came from. And then, we're a regional foundation here in Northwest Arkansas, serving really three counties, Benton, Washington, and Madison County. Okay. And so kind of a smaller regional foundation here. But, back in 2016, the superintendents from kind of the big five school systems here in Northwest Arkansas came to the foundation and said, we have this problem, and it's kids come to school, they're not ready to learn. And it doesn't really matter how great our teachers are, our facilities, our curriculum, our technology, all this. The problem is bigger than what the schools can address. And so how do we think about this problem as a community, and how that relates to not just education, but kind of every aspect of Northwest Arkansas? And so we really started with, okay, how do we define what the challenges are specifically in Northwest Arkansas that are contributing to this? So versus looking at this nationally and trying to translate that. So in 2016, the foundation funded a research project called Join the Solution that really tried to answer the question, why are people in Northwest Arkansas not thriving? And so with that, it was about 3,000 surveys, about 350 focus groups. And what we found was that Northwest Arkansas is resource rich, which is usually not a shocker to anyone. We're kind of a unique place here, but Northwest Arkansas is also connection poor. So we have all these resources available, but we don't have good mechanisms for people to know, where do I go when I need help? Where and what's out there, what's available? How do I get connected to those things? How do I navigate sometimes really complex processes as a part of this? And so we said, okay, that's kind of the challenge that the community said. Here's the problem that we're looking at. Well, okay, then, what are the solutions? And no better people to ask than the people in the community to say, okay, if you had X amount of dollars or whatever, how would you fix the problem? And so from that, 16 solutions came back. Those 16 could be boiled down into about four main things. And the first was, Northwest Arkansas needs the existence of kind of a platform organization, if you will. And what I mean by that is, in my background, I'm a licensed clinical social worker, and that's what my career has been up to this point. And when I was working in community mental health or direct service, practice or those kind of things. But when I was in community mental health, I saw like 7 clients a day, like 35 a week. Like, I didn't have the space and time to go, all right, I can tell you all day what the challenges are, but I don't have the ability to go spearhead community-wide initiatives on how to solve systemic problems. And, no one has capacity to do that. So the community said, first and foremost, we need an organization that's kind of your role, is to look at that at a community level. Next, the community said, hey, we need more collaboration. We need more organizations working together, connecting, within sectors, across sectors, those kind of things. Thirdly, they said, we need kind of people who are working throughout the community, helping people navigate and connect to resources. So not just, hey, I'm in this organization and I'm gonna do that, but it's going to be really connected to my organization. We need kind of a group of people that anybody can come to for any reason at any time, and figure out how to what path they want to go down when it comes to these resources. And then lastly, the fourth piece of that was the community said, we need technology solutions. And, there was this kind of really big push to say, hey, nonprofits don't have massive tech budgets to develop technology and buy into these systems or whatever. So they said we need good technology solutions that is accessible for our community. And so with that knowledge, really in 2017, the foundation went down the path of taking all of those pieces that the community really said and building out an organization that really had all of those pieces as a part of the puzzle. And so that was really in 2017, the launch of Hark.
It's interesting that, the explosive growth and the resource rich that you mentioned often leaves people behind. And I think it's interesting that and promising that Northwest Arkansas has recognized that in the midst of growth rather than kind of at the peak of growth, right? At the end, you go, oh, we left these people behind and we got to do something about it. And oftentimes it's too late. So it's promising that that's being done in the midst of the process to keep those folks in and connected. So that's good. So Hark itself, the platform, how does it function?
Well, and I'll make a slight distinction across. Hark is both a technology platform, but then also really it's a model.
Right.
And I always caution about separating the two things out because I think what has been impactful for Northwest Arkansas is the holistic model of Hark and how all of the pieces work together in order to achieve the outcomes that we want versus just saying, hey, here's a technology platform or a source code or something like that to go, hey, now, good luck with this. And so really it requires, I think that holistic look at a community and all of these pieces together as a part of that. So as my small distinction there, how we really kind of function as an organization. So one thing is we're a division of the Accelerate Foundation, like you mentioned, but we would really categorize ourselves as a connection organization. And our real focus is how do we ensure that people in Northwest Arkansas are able to find out where to go, able to get connected to the things that they need to, so on and so forth. And so we do that primarily via our technology platform, but our team, we utilize a team of about 10 community liaisons. We conduct comprehensive needs assessments for clients who come to us. We work directly with those clients to build custom resource plans. We importantly follow up with those clients to ensure connection to those resources. To date, we've built the most robust map of resources in Northwest Arkansas. We have dedicated staff who maintain that. They update it, they expand it to make sure that we are providing the gold standard of resourcing to individuals in Northwest Arkansas because, and I would say that map is one of the most important pieces of the whole puzzle, because if someone is saying, hey, I need help, and we're sending them to a place that, hey, doesn't provide that service anymore, or we have old information and we sent them to the wrong location, or this place is out of funding, or, it can be so many things. We want to make sure that when we put something on someone's plan, that when we send them to that place, we have verified that place not only is the right place to go, but that they can provide that service to meet that need. And so we also, because we're a part of the Accelerate Foundation, we're able to grow and scale to meet the needs of the community. So, the more people who are in need, the more we'll scale our organization in order to meet that need. And we are completely free to the community in Northwest Arkansas.
So how do people actually plug in?
Yeah, so people come to Hark in two major kind of avenues. The first is harknwa.com /get connected. And so that's just a simple contact page that individuals can fill out. And that goes directly into an electronic queue that our liaisons are monitoring, and they are reaching out to that individual. With very quickly, oftentimes same day, sometimes within 24 hours. But we really prioritize the speed in which we can connect with those individuals, because hey, they need help now, and we want to focus in on that. The other is our kind of unique partnership with Arkansas 211 that we established early in the pandemic. So, Arkansas 211 does incredible work throughout the state. We kind of set this partnership up early in the pandemic where we're both kind of doing similar things. And so in Northwest Arkansas, if you call 211, you're routed directly to Hark. And so we've kind of said, hey, we want to join efforts. We're kind of better together in that sense, and go, how do we leverage our strengths so that people have access no matter what.
Okay. So I did notice that Hark has developed a linkage with the State Health Alliance for Records Exchange, which is the health information system in Arkansas. How does that work, and what's the ultimate goal there?
Yeah, so I'll lay a little bit of groundwork leading up to that partnership, because again, we didn't necessarily set out to be so applicable into healthcare. Honestly, but when we built our map, this is really how we resource individuals. We said, okay, when we're building this database, how should we structure it? And so we said, hey, let's start from the social determinant of health perspective. And so we said, okay, we're going to build out our map based on 10 social determinants of health. We break those into 50 need categories. From there, over 200 services, and to date, over 2,300 solutions that we can provide, or referrals that we can provide to individuals in Northwest Arkansas. And so, this is also not only the relevant organizations, their locations, what services they offer, but this is hours and insurances accepted and contact details and maps to the location and special instructions. Hey, they're closed from 12 to 1. Don't go over your lunch hour. Things like that give really in-depth applicable pieces. So, as we're building these custom plans for individuals, we're also following up with them. And so we interact with a client's plan about 14 times over the course of about 33 days.
Wow.
And so it's really kind of this in-depth process. And not only that, we're assigning statuses at each incremental step of that process. So we have really in-depth information about not just what people are needing, not just what services they're needing, not just what referrals we're making, but what's happening, and what are people getting connected to? What are they not getting connected to? If they're not getting connected, why are they not getting connected? And even as we're building out these plans, we're utilizing things like in this year, we just added 2 new components to our technology, which is a formal needs assessment that assesses on 50 different need areas. It uses skip logic. So it takes about 3 minutes to fill out. You can text it right to somebody's phone that they can fill out, all that kind of stuff. And, we've served since about March 2020, over 12,000 individuals in Northwest Arkansas. And so we're also looking at that going, hey, that's pattern recognition. So we've applied predictive analytics to our tool. So as we're building these plans, it's searching over those over 12,000 other plans, going and building connections to saying, hey, these are similar situations, and people who had similar needs. Hey, ask them about this. Ask them about this. It's literally suggesting other SDOHs, other needs, other services, other referrals that our connectors should be asking. So I say all that to say, we have really robust information about what these individuals are experiencing, what they're getting connected to, what their needs are, so on and so forth. So we said, hey, this is kind of interesting information. Would this be useful to anyone? And remember, we kind of joke, we're a foundation, right? So we give things away for a living. It's kind of our thing. And so I'd become familiar with Arkansas Share, and so we reached out to Arkansas Share and just said, hey, we're sitting on hundreds of thousands of pieces of social determinant of health data. Would this be helpful to anyone?
Yeah.
And and their immediate answer is yes, this would be very
Absolutely.
helpful. So we started working through what a partnership could look like there of allowing this social determinant of health data to benefit the healthcare providers and
Yeah.
and most importantly the patients that they're serving.
Right.
And so we it was kind of a long process. We're a unique use case. We're not the normal organization that Share works with, but we have built out this partnership, and so we're the first ever contributor of social determinant of health data into the State Health Information Exchange. And so what happens when we build a plan for an individual, and our clients consent to all of this, or don't, and it's completely up to them. But if we have consent for that client, when we build that plan, that goes into the State Health Information Exchange, and then those participating clinics and or hospitals or whatever can query that information out along with all of the other health information from other entities, and that can be pulled directly into their EMR system. So Arkansas Share, I may get this a little bit wrong, so don't quote me on exact numbers that you can verify with them, but I think it's over 60 different EMR systems that they interface with, and so what this did was say, okay, if somebody is going to see their endocrinologist and they're going, hey, we're having to up their dose of insulin or medication or whatever every time we see them. What's going on here? Would that be helpful to know that they don't have access to food?
Yeah.
And so we just created a mechanism here that a condensed version of that plan can flow directly into these EMR systems to give hospitals or clinics or whatever just another layer of information to really support their patients.
Yeah, you mentioned it's not the norm, but it should be, and hopefully will be the norm, and that all that information is available.
Sure.
So how does the platform that Hark uses compare to some of the others that have been developed in this emerging market? And secondly, kind of what are the core components for you guys that are going to lead to your sustainability over time?
Yeah, so I'll start by saying, we're a Northwest Arkansas regional foundation, and our main goal is to really focus in on how do we add value at every turn to the individuals of Northwest Arkansas, and how do we give everyone in our community the opportunity to thrive. And so that's really what drives us. So I think the byproduct of that is that we have created a very localized model of support for individuals and resourcing for individuals. So, think about the difference between a platform that is a national platform or beyond that, with very little localized effort. And so your tools at that point are often Google scrapes or things like that in order to build a map of resources.
Right.
The problem with that is that you don't know if that thing that you've just pulled out of Google is 10 years old or 2 days old. And, so that's where we've said, when we built our map, we literally said, okay, here's a social determinant of health, here's a need, here's a service, here's an organization that can provide that at this location in this way. And when we went through that whole process, we had one. And, and so we used to have these things called Harkathons where we just, we'd bring everybody together and we built out our map, literally line by line by line by line, specific to our individual community. And so
crowdsourced locally, kind of. Yeah.
Yeah. And it's just literally our team and then our ability to then deeply engage with our community so that, you think about these these 10 liaisons that are on our team who are just phenomenal at what they do and are so engaged in the community. And so we literally have the ability tactically to know week to week, day to day, sometimes this organization is out of funding and they won't have it till the next month at this time. So we go in and turn that off in our map, because we don't need to send people to some place that isn't able to provide that need at that time, right? And then we go, hey, funding's back on. Guess what? Turning it back on. So I think, not only the usability of our technology platform, the tools that really I think are unique to our platform, like our needs assessment, our predictive analytics, the ways that we really focus in on our technology, not only resourcing individuals, but helping helpers be better at what they do, and not because they lack a skill, but because again, this is my world, and it doesn't matter how good I am at resourcing people, I can't know 2,300 options in my head. And so how do we leverage technology to do that? But we kind of have at the Accelerate Foundation these three lenses that we're able to approach all this through. So one is social services, one is philanthropy, and the other is business. And we're able to bring these kind of three pieces together to create some unique models. So the thing that we don't often talk about as much is we have this whole analytics side of our technology, that as you're building these plans, it's giving you real time. Our data updates every 2 hours. And so real time views into the needs of the community, all of these kind of things, we can look and go, hey, we're sending so many people to this place, we're overloading this nonprofit. We can call them up and go, hey, how you guys doing? Except for that we know how you're doing, because we're overwhelming you guys. So and so we can work with them to go, hey, what do you need in order to meet this need? And so we can pull in that philanthropy piece. We have really strong business acumen. So we've got a whole section in our technology that is just kind of performance management, and how do we think about measures of a quality plan and efficiency and effectiveness? How do we look at our teams and manage across all these different aspects? And we're very much data as a flashlight, not data as a hammer. I always like to make that distinction, because how do these tools make us better and better at what we do? So I think there's the localized aspect of it. I think the uniqueness of the way that we have built these tools, and then all of the value it gives you on the back end to really understand in depth. And honestly, it's why, the Accelerate Foundation doesn't just say, Hark's a thing we do. It's foundational to the Accelerate Foundation, because it's giving us these community insights into what's going on in our community and how we can address it systemically.
Sounds like a recipe for success, I'll tell you. So you and I are both well aware of all the challenges that our communities have faced during the pandemic, and in the face of those challenges, we know that there are always the helpers who shine, right? And I was able to attend the event that in Northwest Arkansas recently that celebrated some of those successes. Can you share a couple of those that come to mind for you?
Oh yeah, I mean, we always say, Hark's main focus is connection, right? And so our role in the community is to connect individuals to our unbelievably amazing network of nonprofits in Northwest Arkansas. And so, yeah, I mean, every chance I get, I want to talk about the incredible work that they're doing, because it's pretty phenomenal. A few things that come to mind is, you've got organizations in Northwest Arkansas like, the Samaritan Community Center, who, in a single year, they served over 88,000 meals. They provided, just shy of $500,000 in free dental care, did 180,000 snack packs, and provided over 96,000 individuals with food. Wow. And that's just the tip of the iceberg. You've got these innovative things going on, where Benton and Washington counties, during the pandemic, they became aware of funding that was available that was super outside the scope of their normal way of doing things. You think these are county governments. They're not, people who are in depth in social services, but they secured funding. They established these new distribution models to figure out how to support individuals, and collectively distributed over $27 million in emergency rental assistance. Wow. In 2021, and then, I mean, I could go on forever, lastly, you've got organizations like the Northwest Arkansas Food Bank, who, again, in just 2021, they served, over 479,000 households, and 1.2 million individuals with food. They distributed 14 million pounds of food and 11.3 million meals. And, this is at a time when our community was really hurting. I mean, they saw, I think it was a 229% increase in the total households and 162% increase in the total individuals served in 2021. And so, I mean, that, again, we could spend an infinite amount of podcasts just talking about the incredible work that goes on. And that is three very quick examples of just the amazing work that happens day in and day out that most people don't even know is going on. But it's really foundational to everything. Yeah.
Goes to that immense need that was seen over the last couple of years, and how they really stepped up and met that need with overwhelming success. So what's the future of Hark?
That's a great question. And, again, from I'll kind of answer this in two parts, because as a regional foundation, like I said, our main focus is Northwest Arkansas, and what we want to do is get better and better and better and better at helping our community, putting tools in the hands of providers. Because one thing I don't know that I've mentioned thus far is that we also make this tool available to any nonprofit organization, any organization that is connecting individuals to resource. They can use it free. I mean, we come in and just train them on it, and they have full access to it. They have full access to their own analytics. They have, all of the pieces that are there. So, for Hark, we kind of say, hey, what we have going on is really, really good for today. But what about tomorrow? And we want to just continue to grow as an organization, continue to add value, continue to find more efficient and effective ways to connect people, to make sure that they know that if they have to raise their hand, sometimes for the first time, and say, I need help, and I don't even know where to start, that they have a safe, confidential place to come, who is going to walk along through this with dignity and respect with them. And that's our focus, is how do we help people in Northwest Arkansas have the opportunity to thrive at every turn? How do we continue to grow? How do we continue to add value across the board? So that's really the Northwest Arkansas focus. And that's what I would say is our primary focus. I suspect in your question, there's also maybe a sub question, and there
might be an sub.
That is, well, what about outside of Northwest Arkansas, right? And so what I would say is while that's not our primary focus, there is a what I would categorize as a strong growing interest in how other communities could take the Hark model and take that into their communities with the same goal to enrich the experience of connection to resources and things like that within their communities. And so, while we operate in those 3 counties, we're very up for those conversations, and those conversations are happening. And while it won't be necessarily us probably taking it out there, I know that there are a lot of really great organizations who want to talk about that.
Yeah, you can take the technology, but you got to also replicate within the model the funding and the philanthropic aspect and the business acumen, and those are those additional critical pieces that I think others are going to have challenges trying to find. But if they're willing and able, then I certainly see how it could work. So beyond Hark, the Accelerate Foundation, what are some of the other pressing initiatives that you guys are working on?
Yeah, so it's a great question, and again, we really shifted kind of in I would say largely probably around 2019 to really looking at bringing these two strengths of Hark and the foundation together. And so how do we really understand our community in depth, and how do we react to it? And so, we also refer to Hark as kind of the listening arm of the foundation, if you will. And so when I say, earlier that Hark is kind of foundational to the foundation, in a sense. So Hark really does 5 things, right? We connect with people, we uncover needs, we build a quality plan, we follow up, and we connect. And what that gives us the ability to do on the foundation side is really listen to our community.
Yeah.
And that is at an individual level. So we have, again, since March 2020, we have over 12,000 people telling us, hey, here's what I need in the community. Here's what's going on. And so we're able to then understand what the top needs are, and then take the foundation resources and all of that and link it together with what those individuals are saying. So I always describe it as linking the individual's experience in the community with the systemic change outcome that needs to happen. And so that's the power of bringing these two worlds together. So I say that to say that, what we're learning from individuals in the community and through the Hark data is directly impacting the strategic direction of our foundation. And so maybe said even in a different way, what the people are saying they need is what we're focusing on as a foundation for our strategic pillars. And so we have really 3 main areas that we work in. One is affordable housing. It's the #1 need in Northwest Arkansas. It kind of dwarfs everything else. And so we're very involved in a few different aspects of that. And one of those is kind of in the immediate housing assistance funds. And so we have some funds that we have internally that we've developed to help stabilize individuals who kind of have an unexpected thing come up, and it puts them into a financially uncertain place that, hey, they can't pay their rent that month. But this is kind of a temporary situation, and we want to help make sure that individual stays stable and doesn't kind of get into the snowball effect that can happen as a part of that. We distributed the Benton County emergency rental assistance dollars. It was about $16.5 million that we distributed in total. So that's kind of the, hey, here's the immediate tactical stuff. Then okay, but we can't pay for an imaginary apartment that doesn't exist, right? So we've got to increase the supply of affordable housing. So the foundation works with LIHTC developers and different organizations like that to get some of these projects, low-income tax credit housing projects built. And so this is affordable rates locked in for 35 years. And so I mean the overall savings for a community in that is astronomical over the course of 35 years of what that allows for individuals. And so I think there's about 6 projects of those going on. The foundation helped organize a $40 million housing syndicate to help increase the amount of affordable housing going on in Northwest Arkansas specific. And so really involved in that, and not just affordable housing, but affordable communities. And so how do we bring all of the pieces of a community together, and so to really make sure that people have not just an affordable place to live, but a place where they feel safe, a place where
Mhm.
they have access to resources, access to transportation, access to employment, access to all of these things,
Yeah.
access to food when needed. So that's affordable housing. We have a pillar in education. And so, as we have seen throughout the pandemic, the categories of help pay for housing and help pay for food, help pay for healthcare, help pay for transportation, that really becomes to the forefront. And we know that 67% of the jobs in Northwest Arkansas fall into the employed but at high risk category.
Mm.
Meaning that someone may need about 14 months of income to cover 12 months of cost, and it really doesn't matter how you do that math. It just doesn't
Yeah.
work. And so the need there is, hey, we've got to find a way to help people increase their wage earning abilities. So we launched an organization called Upskill NWA that upskills healthcare workers to higher wage earning positions. They have kind of a steady state of 100 students who are going through that cohort. It was a huge collaboration between all the education institutions, all the healthcare institutions, all of that. So these individuals who are wanting to either enter into the healthcare sector or upskill from their current position to a higher wage earning position have the ability to do that with all the support, all the help that they need in order to be successful as a part of that. And then lastly, we have a pillar on social support, where we're looking at many different aspects of social support on how do we connect our community across lots of different areas, but socioeconomically, racially, how do we connect our community to be a more kind of cohesive place for individuals. We partner with an organization that's been doing this for over 20 years in Northwest Arkansas called Potter's House, that we built a playbook on how you build diverse relationships, if that's a focus of what you're wanting to do. And so a lot going on in the foundation, and we could again talk a lot more in depth on these things, but really, the unique piece there is how that Hark and the foundation are working together to identify the largest needs and then bring
Yeah.
systemic and drive systemic change towards helping those.
It's really interesting how the tool itself allows you to connect with people and address their individual social needs. But then at the population level, it's an amplifier to identify those social determinants that need to be addressed out in the community to help them thrive and be able to connect better. So that's
absolutely. And that's where, again, when you look at the whole model, I mean, there's so much more than just, hey, I'm gonna help this person know where to go to get some help. That is one incredibly important and vital piece of this, and one of our main focuses. But where you start to see the ongoing systemic impact is all of these things after that. And to give you one quick example too, just it's not just us. I mean, again, we give things away for a living. So, as we're getting all this data, we publish it out. And so anybody has access to our data. So one example that we saw was the Fayetteville Police Department. So Fayetteville, Arkansas, here in Northwest Arkansas, the police department of all places took our just published data out there. We didn't even know about this, and they took the data and applied for a federal grant to hire 2 social workers to work within the Fayetteville Police Department alongside officers to help people who need a social service intervention, not a law enforcement intervention. And so they were awarded that grant. They hired 2 social workers. Then they called us up and said, hey, we need a tool to resource people now that we have 2 social workers. So we gave them access to the Hark tool. So now they're collecting their own data to show the effectiveness of this program, and will then utilize that data and information to provide sustainable funding for this program long term. And their goal is to replicate that through every police department in Northwest Arkansas.
Wow.
And so again, just these unintended consequences, if you will, in the most positive sense possible, of just going, hey, here's what we're learning, and what can our community do with that?
Yeah, that's great. So final question for you, goes back to you as an individual, since we talked about all of these large and complicated issues. If there were one piece of advice that you could give the students looking to get into social work, what would that be?
Oh, it's such a good question. And, let me answer it, in a couple ways. I think that one, I think it's truly a gift in the helping profession and for our communities, and should never be undersold. And that is an individual's ability to look past someone's circumstances, someone's challenges, someone's situation, and to recognize the humanity in that person.
Mm-hmm.
And if that's something that you identify with as a person, I think social work is a great thing for someone to pursue.
Yeah.
And the other thing that I would say is, I remember the first time I considered social work as a profession, and someone who knew me very well had mentioned that I should look into this, and my immediate reaction was almost no, because I had such a limited view of social work, and I'm like, oh, so this picture I had in my head of the profession was not something I wanted to pursue. And the more I learned, just how broad the focus of social work is, and all the different ways that you can engage with your community, with, at the individual level, the community level, the national level, all of that, from being a counselor and providing individual therapy, all the way to major policy work that can happen. And so, if a student's interested in it, I would say, dig in and learn the scope of it. And there's a lot there, and it's a great field to be in. And it's not easy, and or any of those things, but it's really great. So yeah, I encourage, if anybody relates to that, go check it out.
Some great advice. So thank you so much for joining us on the podcast, Josh, and sharing a little bit about Hark and the Accelerate Foundation and yourself and all the energy going on in Northwest Arkansas. I really appreciate it.
Yeah, well, thanks so much for having me.
Thank you for listening to Wonks at Work. You can listen to our bi-weekly podcast on our website, achi.net. A special thanks to the Bobby L. Roberts Library of Arkansas History and Art, which is a part of the Central Arkansas Library System, for allowing us to use their studio to record. If you have any topics you would like for us to consider, please email us at achi@achi.net. As a reminder, the views, information, and opinions expressed by our podcast guests are solely those of the guests and do not necessarily represent those of the Arkansas Center for Health Improvement. The primary purpose of this podcast is to educate and inform. The podcast does not constitute medical, legal, or other professional advice or services. We hope you've enjoyed our latest episode, and again, thanks for listening.